meningococcal disease can quickly become deadly. In fact, the U.S. Centers for Disease Control and Prevention and the Florida Department of Health are investigating the outbreak in Florida and found 26 cases and 7 deaths for meningococcal disease during the investigation period. Among those cases, 24 cases and 6 deaths were in gay or bi men, or MSM, men who have sex with men. The CDC has called this moment that we're in right now, this outbreak in Florida, as one of the worst outbreaks of meningococcal disease amongst gay and bisexual men in U.S. history. But we know anyone can still get it, not just gay or bi men. The good news is that neither meningococcal disease nor monkeypox is new. We know how it spreads, and we already have a safe and effective vaccine that can be taken to protect yourself, your family, and your community. So there's no need to panic, but there is a need to get the facts and get your questions answered. So that's why we're having a discussion today. We've put together a small group of experts and community leaders who can tell you exactly what you need to know about what's going on. Just a bit of housekeeping items before we jump into this discussion. This video is streaming on our Facebook page and on YouTube. Once we finish our event, those videos will be available to watch later. So feel free to watch it in your own time, share it with your friends, share it with your social media channels. We've also developed a list of frequently asked questions, but our team will be monitoring the comments on our Facebook Live. So if you have questions, please put them in the comments, and we may have time to get to some of them again at the end, but we will try to incorporate them as we move along as well through our discussions. We also have captioning available in English and in Spanish, which you can find in the description and in the Facebook comments. We will be periodically posting the link in the comments for your convenience. Para quien quiera ver nuestro programa en español, tenemos subtítulos disponibles en el enlace, el link, que se puede encontrar en los comentarios de este live. So, let's bring in our experts. We've got 3 amazing guests with us here today. I want to do some quick introductions, and then we're going to get to know them better when we jump into these discussions. First, we have Dr. Raul Pino. Dr. Pino currently serves as the Orange County Director of Health Services. Thank you for being here, Dr. Pino.
Thank you for having me.
Next, I'd like to introduce Miss Alvina Chu. She serves as the Director for the Division of Infectious Diseases at the Florida Department of Health in Orange County. That's the DOH Orange. Thank you for being with us.
Thank you for having me.
And last, but certainly not least, we also have Dr. George Wallace. George is the Executive Director of the LGBTQ Center in Orlando. Thank you all for taking the time to be part of this community health update. So we are going first to go over to a conversation one-on-one with Dr. Raul Pino. So I want to kick this off really just by chatting with you, Dr. Pino. You all probably recognize Dr. Pino, first of all, through the pandemic, because he previously served as the Chief Health Officer of the Department of Health in Orange County for 3 years. From March of 2020, Dr. Pino worked side by side with Mayor Demings through 166 COVID-19 news conferences. That's a lot. He currently serves as the Orange County Director of Health Services. And of course, he was appointed by Mayor Demings in April 2022. As the Director of the Health Services Department, Dr. Pino now oversees all strategic, operational, and fiscal responsibilities of the department, which includes the oversight of the county's corrections health services, drug-free office, Orange County Medical Clinic, Animal Services, and Mosquito Control Division, as well as really any response to a unique public health matter affecting Orange County residents like this one. So, Dr. Pino, Thank you for joining us. I want to bring you in first because not only do so many people know you, but they trust you, Dr. Pino. During the pandemic, you were very steady, you were very calm, you gave people the facts. So kind of help us understand what these diseases are. They've been around for a while, meningococcal disease and monkeypox diseases. How are they spread? What are the signs and symptoms? And what can happen if this is left untreated?
Well, they are different in the possible outcomes. Meningococcal disease is an aggressive infectious disease that, untreated, in many cases, could develop into, poor health outcomes and death. And in some cases, even people that survive can have long-term consequences in developmental areas. But the good news about meningococcal disease is that it's treated appropriately and on time, all those bad outcomes can be prevented. The issue with meningococcal disease is that it spreads even with people when they are asymptomatic. The bacteria could grow in the upper respiratory tract, is transmitted by droplets, and generally by people who are very close to you, physically close to you. Household contacts, dormitories, prisons, colleges, that type of environment with high density population. It normally develops in 3 to 4 or 5 days, and it could be a sudden onset of fever, muscle ache, headache is very prevalent, and the neck can become stiff, and also people get very sensitive to light. And that's a very particular characteristic of it. The health department, and Albina will talk about this probably later, trace contacts and can do prophylactic treatment for those that the monkeypox with symptoms. Well, it's like you are having the flu. It's basically what you feel. But again, many people will not develop those symptoms. And you can acquire by getting in contact with fluids from that individual that is infected, or either from body fluids, but also from fluid from the skin lesions on the individual, or even fluid left in surfaces like bedding and other materials that are in close contact with the individual. So it's important that people who have been or thought that they were exposed to either disease contact their providers.
Well, thank you for giving us that information. I think that that's really helpful just in kind of understanding what the signs are, what the symptoms are, how people can get infected. I think really what my next question is who is most vulnerable to contracting meningococcal disease or monkeypox, or not even necessarily just contracting it, but who's most vulnerable to being negatively impacted by it if they contract meningococcal disease?
So in the current outbreaks in Orange County and in Florida, most cases in both has been in men having sex with men. Now, this doesn't mean that these are gay disease. These are just disease that anyone can acquire. What happened is that has been transmitted among people who have sex with men or people who are or identify themselves as gay. But it could at any point break that group and move into the general population. It's just to be clear, not to stigmatize any specific group. These are diseases that are transmissible and can go into any group or subgroup of the population. Now, what happened is that have to be intimate contact. And in the case of the monkeypox, has been closely related to men having sex with men and happen during sexual encounters. The diseases itself are progressing, some more aggressive than other one. Monkeypox, Florida has already 72 cases in the most outdated data that I found in the CDC website. But the reality is that also people with HIV are especially sensitive to any infectious disease. And that's why meningococcal vaccinations is a standard of care for people who have HIV. So even in the absence of an outbreak. So it is important for anyone who is HIV positive to know that as a standard of care, they should have been vaccinated for meningococcal disease. In the case of monkeypox, and Albina probably will talk to this about this, the vaccination is a little more restrictive as they are following and tracing context.
Got it. This is super helpful as far as giving people the information that they need to understand what their level of risk is. We already know that bi and gay men in Florida are, certainly more vulnerable because it is spreading so much amongst our community. So it's very important that they get vaccinated specifically for meningococcal disease, as I know I will be doing as well. My question is if someone sees some of the signs and symptoms and they think they actually have contracted either meningococcal disease or monkeypox, what should they do? Should they go to the ER? Should they call their doctor? How do they respond if they believe that they have the signs and symptoms or they believe they've contracted it?
Two different paths. Let's talk about meningococcal disease. As we mentioned, it's more aggressive, and if you are having symptoms and you think you were exposed, you should immediately seek care. Whatever the mode that you use to seek that care. It could be the ER, it could be in a standing alone, it could be calling your provider and letting them know that you were exposed or have symptoms. And especially if the light bothers you, you have headache, and your neck is stiff, I will go to the ER. I will go as soon as I can. For meningococcal disease, it's a matter of hours to get treatment and to be able to curtail the disease. Monkeypox is a little bit different. It's very fatal. And although, people get very bothered by the skin lesions that may develop, it's not as infectious and it's not fatal. So the advice is, of course, always call your provider. You don't need to rush to the ER. And if you are going to decide to go to an ER and you think you have been exposed to monkeypox, it's always best to call them first so that they are prepared to treat you and receive you, because they have to have a special precautions to do that. In this case, you can also call your local health department and talk to someone and get information that you need so that they can offer you fresh information about it.
Well, listen, Dr. Pino, thank you once again for giving us the facts, as you always do. I do want to shift gears now over to our next guest, because we are now going to continue the conversation with Miss Alvina Chu. So we're going to chat with Alvina, who serves, of course, as the director for the Division of Infectious Diseases at the Florida Department of Health, Orange County. That's DOH Orange. She is responsible for providing oversight for the immunology, HIV prevention, sexually transmitted infections, tuberculosis, and refugee health, epidemiology, and research programs. Prior to taking on this role, Ms. Chu served as the program manager of DOH Orange's epidemiology and research program, where she was responsible for acute infectious disease investigations. And most recently, she directed contact tracing efforts during the COVID-19 pandemic. So, Alvina knows what she's doing. Thank you for joining us today. Listen, Alvina, we know Orange County has been almost at the epicenter, at least specifically for the meningococcal disease outbreak. Can you talk to us about what you're seeing as an epidemiologist here locally? What is the current status of the meningococcal disease and monkeypox outbreaks in Orange? How many cases have we seen in our area? And what does contact tracing even look like? And what is the DOH doing to prevent it from getting worse? It's a lot of questions, but we got a lot to cover.
Right. So let me just start with the meningococcal disease outbreak right now for Orange County residents. So currently there are 14 confirmed or probable cases. And while that may not seem like a large number, all of these cases have been hospitalized, and unfortunately, 3 of these patients have died. So we really want to get that message out, that although it might not seem like there's a large effect, there can be very serious sequelae or serious consequences. There are currently 5 confirmed or probable cases of monkeypox here in Orange County residents. Fortunately, none of those have been hospitalized or died so far. For the meningococcal disease outbreak, all of our cases here have been in persons who identify as men who have sex with men. And that is the same for our monkeypox cases as well. And so these 2 outbreaks have disproportionately affected, particularly the MSM population here. So we've been collaborating with our community partners to provide health education about the outbreak, the diseases and vaccinations for prevention at community outreaches and events, which you'll hear about from George at the center a little bit later. And to date, we've given over 600 doses of the meningococcal vaccines at these outreach events. You had mentioned about contact tracing and about our current limited supply of the vaccine. So right now for the monkeypox vaccine, which is available, here in Orange County, it is being used for those persons who have a high risk known exposure to a confirmed case of monkeypox. And so to prevent disease in those who have been exposed in the riskiest way is where we're using the vaccine at the moment. We're hoping that the supply will soon be more readily available so that we can continue to offer the vaccine to those who are at high risk.
So what I'm hearing, Albina, and thank you for that, is that, we already know that the CDC is recommending for gay and bi men to get vaccinated with the meningococcal disease vaccine. We also know that that vaccine is not only been around for a long time, but it's also readily available. So folks they should be able to go to their pharmacy. I think that they can consult with their doctor, also go to the DOH. Can you tell us a little bit more about, I guess, how easy it is to get the vaccine for meningococcal disease, and what the cost might be, whether you have insurance or not? How easy is it for folks to protect themselves from meningococcal disease with this vaccine?
The meningococcal disease vaccine is readily available, as you had mentioned. And during this outbreak, anyone can get the conjugate meningococcal vaccine at no cost at any county health department. We do have the quadrivalent meningococcal disease vaccine, which protects against 4 serogroups, the A, C, W, and Y. And currently, this outbreak occurring in MSM in Florida is primarily caused by serogroup C. As you mentioned, the vaccine's been around for a while. The Menveo vaccine was first licensed in 2010. And so we have a good vaccine readily available at no cost to those at high risk that can protect against any further disease.
Yeah, and just so that folks, understand, with monkeypox, it's more about, have you been exposed to monkeypox? Are you someone who's a known exposure, which, you would know through contact tracing? And I suppose maybe someone who thinks that they have been exposed to monkeypox or has signs or symptoms, once they consult with their physician, then it's possible that they would be able to get the vaccine shot. But I want to make sure people know that, the monkeypox vaccine, because there is the low supply, is not necessarily available to just anyone who wants to get it preventatively. That is something that is only right now, at least because of supply, restricted to those who are exposed. Is that correct?
Exposed and at high risk, yes. And also those who are at risk for severe disease from monkeypox, such as persons living with HIV or other immune compromising conditions.
Got it. Now, I want to kind of also ask a bit about the college population, the student population, because we've heard a lot about, yes, how gay and bi men are vulnerable to monkeypox and meningococcal disease, that also were the ones that have been most impacted as far as ones that have been contracting it. But we also know that college students, folks that live in dorms, in close corridors, on-campus housing, fraternity houses, sorority houses, can you tell us about what that what that level of risk is, but also kind of what the outbreak trends have been? What should students like at UCF and Valencia be aware of?
So as Dr. Pino had mentioned, the mode of transmission for the meningococcal bacteria is through essentially contact with the respiratory droplets. So being in close contact or proximity of someone for a long time and being exposed to their respiratory droplets, but also sharing secretions or sharing saliva. So essentially, sharing food or drinks or kissing partners or, any of that kind of close contact would be how this disease could be transmitted. And so it could be, as Dr. Pino had mentioned, in any congregate living facility. Also, the meningococcal vaccine is also recommended. The American Pediatric Society recommends it for children. And so it's on the routine recommended schedule. So children who have been vaccinated against meningococcal disease may have some waning immunity if they were vaccinated when they were young. And then by the time they get older and go away to college to a congregate setting, leaving mom and dad's house where it's just maybe a few of you to living with lots of people, these kinds of outbreaks can occur. So partially the close proximity, the living together and sharing close quarters and spaces. Also, I would guess in college there's potentially a lot of sharing of drinks. So that's as a possibility of how the disease could be transmitted. And it's not just college settings, congregate living settings. There have been outbreaks identified in, say, correctional facilities and jails, and then also in like Army barracks or bases.
So I know that we're talking obviously about the hot topic, which is the outbreak with meningococcal disease and with monkeypox in Florida. But, these are not the only things that are going around that folks should be aware of. I understand that there's also a question about hepatitis A. I don't know that I would call it an outbreak. Should we call it an outbreak? Tell us what you know about what's happening with Hep A locally and what folks can do to protect themselves there.
So we think we would call it an outbreak. And so I don't know if you remember, in 2018 and 19, we had a very large nationwide outbreak that occurred primarily in persons who are experiencing homelessness and persons who are use drugs. So this prior to that large outbreak, the prior 5-year average for hepatitis A cases in Orange County was 1.4. Currently, we have 59 outbreak-associated cases here in Orange County, and this outbreak is affecting a very different population. And so almost 80% of those cases have been hospitalized. 95% of those cases are in males, and over 60% are in those who identify as a man who has sex with men. And so while hepatitis A hasn't been on the forefront of the conversations recently, it is a third concurrent outbreak that is currently occurring in Orange County right now. And so we're seeing it affects the same population that has already been affected by meningococcal disease and by monkeypox. And so anyone, however, like monkeypox and like meningococcal disease, anyone is at risk for getting hepatitis A unless you've had confirmed disease in the past or if you've been previously vaccinated. And the best way to prevent hepatitis A is to get vaccinated.
Well, Ms. Chu, thank you so much for giving us this information. We really appreciate you providing the expert insight here that obviously that you've been able to accumulate over your experience, not just through what's happening now, through COVID, everything that you bring to the table. You're seeing it on the ground, you know what's happening. And I know folks watching now have a much better idea of their level of risk, what they can do, not only to protect themselves, but their families and their communities as well. So thank you.
Thank you.
Thank you. So now we're gonna segue over to our friends, many of you in the LGBT community or in the allied community, you already know. It's our friend, Dr. George Wallace. Dr. George Wallace is the executive director of the LGBTQ+ Center in Orlando, Prior to his role at the center, Dr. Wallace served as the ED of the Orlando Fringe Festival. We love Fringe Fest. We know, of course, at the LGBTQ plus Center Orlando, that the mission there is to promote and empower LGBTQ people and our allies through information, through education, advocacy, support. And of course, that includes the services you provide. That's counseling, that's mental health support, HIV and STD testing. Really, George, you and the center are our rock and our trusted partner in so much that we do. So George, let's just talk about this. The CDC, as we've mentioned several times during this discussion, is advising that gay and bi men who have sex with men, MSM, living in Florida or even visiting Florida, get vaccinated against meningococcal disease. It's also extremely important to remember that this is not a gay disease and that there's already a huge stigma around those impacted by this outbreak. Can you tell us about what you have seen and how the LGBTQ community is responding to this outbreak, and kind of talk about the importance of getting around that stigma and perception that people might have that this is just a gay thing? It's not, while also making sure that our community understands we're at higher risk and we need to do our part to protect one another.
Yeah, and thank you, Carlos, and thank you to the Department of Health, because over the last 2 weeks, the center has had a couple of pop-up vaccination events at Savoy and at the center, and it's important. And we were able to get over 150 vaccines in arms. I think our community is taking this very seriously when, you know, you're seeing it on Good Morning America and the Today Show, and you're seeing it on Facebook, and people are heeding the warning and they are being vaccinated. So the vaccination events were both Hep A and meningococcal.
So thank you for that. I know that you've partnered with Savoy and that you're probably going to be planning some future events as well, as far as being able to expand access to meningococcal disease. So, you know, our community, we've been through so much, not just recently, not just with everything after Pulse, not just with everything that's going on in the political environment here in Florida, but, you know, just thinking about the AIDS crisis, thinking about how we had to deal with not only the human toll and the stigma and how we have to take care of one another in this community, particularly in the LGBTQ community. Can you share what is your personal perspective on what we learned from the AIDS crisis, and how this outbreak, which is a crisis, it's a deadly outbreak, how is this different from the AIDS crisis?
So I appreciate that so much. And, you know, as was said earlier, 7 deaths, 7 could become 70, could become 700. And we don't want to see that. And if the AIDS crisis taught us anything, it is resiliency. And our community is extremely resilient. That's why part of our mission is to serve our community, but our allies. And I want people to know that the center is here 7 days a week. And it's important to know your status. And HIV, there is so much stigma around it, and it's not a gay disease. And 40% of the people that come through our door identify as heterosexual. They trust the center to come in and get their testing. And as was said earlier, disproportionately affecting HIV patients. So know your status, come in, get tested, it's free, schedule something with the Department of Health, get your vaccine. It's treatable, it's preventable.
It is so preventable. And that is the thing that kind of stood out to me the most, that, you know, the difference between this crisis and the AIDS crisis, because it's very early on. I mean, there's a lot of obvious differences. The difference is meningococcal disease, monkeypox, did not come out of nowhere. We know how it's spread. We know about these diseases. We know how to protect ourselves. There's a vaccine for this. There wasn't a vaccine for HIV during the AIDS crisis. And there was a lot of panic. There was a lot of tragedy, you know, the human toll was horrific, but but we already know how to protect ourselves from meningococcal disease. Get the
We do.
vaccine.
Yeah, get the vaccine.
vaccine.
And if you think that it can't affect you, so one of the 3 people that passed away here in Orange County, I knew. I mean, it was a friend of a friend, but still, I was actually at the event at Savoy doing the vaccines with the Department of Health. And there was someone in line and he came over and we were talking and he's like, yeah, my cousin died. And I was like, oh, I'm so sorry. And he showed me I said, maybe I knew him. He showed me his Facebook picture and I instantly knew who it was. I've sat and I've had drinks with him and we've had conversations before. So while it was a secondary, I know you, it does impact our community, and we're a small, tight-knit community here in Orlando. And I want to see my friends and I want to see my loved ones protected. And please just go out and get that vaccine. I had it done, little pain in the arm, but it's better than dying.
100%, 100%. Thank you so much, George, for your leadership at the center, for helping get this information out to the LGBT community that we know is disproportionately impacted and vulnerable. We are going to start to wrap up. There's been a couple questions here, and so if Ms. Chu would like to rejoin, just for us to kind of discuss any final thoughts, but also, we saw a question in the chat about, how does meningococcal or monkeypox, is it affecting queer women? And so, I mean, I kind of know the answer to this. We know that meningococcal disease and monkeypox can impact anyone. Anyone can contract it, but it's mostly being spread right now during this outbreak between gay and bi men, and it's mostly Hispanic and Latino gay and bi men. Isn't that right, Alvina?
Yeah, and so it is about evenly split as far as the ethnicity that you had mentioned, but we're seeing all the cases in predominantly men. But as you had mentioned, anyone is susceptible. Anyone can be susceptible unless they've been vaccinated.
Exactly right. And so while we know that the CDC has recommended that gay and bi men get vaccinated who live in Florida or are visiting Florida for meningococcal disease, they've not made the same recommendation for other populations, with the exception, I think, of those living with HIV. That has been a long-standing recommendation that people living with HIV are vaccinated for meningococcal disease, but that doesn't mean that you should not consider getting the vaccine if you're not gay or bi man who has sex with men. Like everyone should be thinking about this. This should be something that every person should be strongly considering, whether you're someone that the CDC recommends gets it because you're in a vulnerable population or not. This is about protecting one another and protecting ourselves and our families. So thank you, Alvina. This has been a wonderful, wonderful discussion. We're getting ready to land the plane here. I want to thank Dr. George Wallace for joining the conversation from the LGBTQ Center. And of course, I also want to thank Dr. Raul Pino from Orange County Health Services. And I want to thank everyone else. I know that we had some Spanish language translations happening through a translator service, but I want to make sure that the Spanish speakers hear this. Es muy importante que cada persona conocen y saben cuál es la situación con esta crisis, con meningococcal disease y también con monkeypox. Hay una vacuna y esta vacuna es segura, funciona muy bien y sí se pueden protegerse en contra de meningococcal disease. Vacúnanse, eso es muy importante, pero especialmente para los hombres gay, que viven aquí en Florida, porque nosotros somos más vulnerable. Necesitamos proteger la comunidad, nuestra familia y nosotros solo. So thank you all for being part of this discussion, tuning into our community health update. Each of these panelists really brought facts and arms people with information so that they can make smart decisions on how to protect themselves, their families, and their communities. Those who know me understand that I care a lot about our community, and that's why we had this conversation. Getting this out there is how we're going to get through this together and how we are going to save lives. I personally have already made my appointment to get the meningococcal vaccine. It's already set, and I will be sharing all of that on social media as well so that we can encourage our friends and other folks to do the same. So thank you for tuning into this update, and please check back on our social media channels so that you can get more information about how to protect yourself and others, certainly from this outbreak. So thank you all and take care.